I think we can start so that we can be able to use all the time that we have for our session. So, greetings, everyone. Thank you so much for joining the webinar. We're really excited to take this journey with you. My name is CE-EIDM Mwabe. I am the director and the co-chair of the Africa Evidence Network, and I'm one of the organizing team members for this community of practice. We would like to, I think, take this opportunity to welcome you to our first virtual meeting for the community of practice on citizen engagement and EIDM. So this has been a very exciting journey for us. In the beginning, as Africa Evidence Network, we did a webinar in November last year to explore this particular topic. And whilst we were doing that, we saw WHO was doing the same thing. And then we thought, oh, let's see how best we can collaborate. And fortunately, they said yes to collaboration to see how we can together explore this topic and try to work together and build a community of practice. And after that process, we tried to sort of work together as well to put together a concept note that will be able to guide us in terms of how do we begin to build such a community of practice. And we also had another webinar just to speak to different experts in the field, just to understand and explore this topic as well. And the other thing that we did was to do sort of a stakeholder analysis to see who's doing citizen engagement in the continent and globally, so that at least we have a bird's eye view of what is happening in the topic, and so that we don't duplicate efforts, we find the best way to collaborate with everyone doing work in this space. So whilst we were doing that particular piece of work, then Cochrane also showed interest. So you'll see that this community of practice is really a partnership of 3 great organizations trying to build something great, particularly with a focus in the health sector. So we are so excited that you are joining us today to journey with us and build this community of practice going forward. So welcome to this meeting. I hope you will stay in forever and hold our hand as we build this. I think then the next thing I want to do is to do housekeeping so that we make life easier for ourselves whilst we are on this webinar. Number one, I want to just say that this community of practice meeting are open for attendees working on or interested in citizen engagement in evidence-informed decision-making. Just to also let you know, this session is recorded because we want to be able to share it wider to people that were not able to attend this session today, and also to yourselves that have attended this session. Maybe you want to, sit back and listen again to the engagements and the discussions to make sure that we are all on the same page as we progress to building the community of practice. And the other issue that we'd like to request, please turn off your microphones when you are not speaking, because we want to make sure that the recording is clear. There's no background noises around it. And also you can also switch off your camera. You can also use it whilst you are speaking for those that are having a low bandwidth, so they can be able to stay on the call and be able to enjoy the discussions. And then lastly, please feel free to use our chat function to share your thoughts, raise your questions. That will really help us to make sure that you are engaged in the session from the beginning to the end, so that you don't miss anything. If you want to ask a question, don't wait until the question and answer session, just type away so that we can feed all those into the session or later on when we do our next steps. So I hope this is really helpful, just to make sure that it's easier for you to be part of this webinar. All the serious stuff off. So we want to do an icebreaker. So at least as we get to know, no, before the icebreaker. Just because I've indicated earlier that we have 3 partners in this community of practice, and we have our organizing team, because we want you to be able to identify this team and reach out when you need to reach out to them about the community of practice. So I want to give them just a moment to introduce themselves so that you get to know who is the team that is working on the background to bring this community of practice to you. So I will start from following the picture so that it's easier to make sure that everyone got the opportunity to just open your mic and your video so that you just say, greet everyone and let them tell them who you are in the process. So I will start with you, Gloria, because you are the first after me.
Hi, everyone. I'm Gloria Anderson. I represent the Africa Evidence Network as a stakeholder management and community of practice program officer. I'm happy to be here and to engage today. If you have anything, please, you'll meet me in the chat box. Thank you.
Hi, everyone. My name is April English. I'm the Consumer Engagement Manager with Cochrane, and we use the term consumers to represent members of the public and patients, and I'm based in Ireland.
Hi, everyone. My name is Lisa. I'm consultant at WHO, also Ubiquinet Global and Ubiquinet Brazil. Thank you for being here.
Hi everyone, my name is Davi Romão, also from Brazil. I'm also supporting as a consultant the Evidence and Policy and Impact Unit at WHO headquarters, working with Tanya, who I'm not sure. Yeah, Tanya's there.
Hi everyone. My name is Tanya Kuchenmüller and I'm leading the unit Evidence and Policy and Impact in the Science Division at WHO. And I'm really excited that we're kicking off today the community of practice on citizens' engagement and evidence-informed policymaking. I'm really grateful to Sandy Oliver that she's going to be the first presenter today. And at the same time, looking very much forward to our engagement with the audience so that we can jointly co-produce and co-shape the community of practice. Thank you.
Hi, and I'm Mareike Gütter. I'm also part of Tanya's team. I'm based in Geneva and I'm the technical officer at the Evidence to Policy and Impact Unit at WHO.
Great. Thank you very much, team, for that introduction. Please look at those faces and remember them so that you can get in touch with us if you need anything in relation to the community of practice. And then I think I was so excited to get to the activity so that we make sure that we get to know you as our participants in this webinar. So we prepared heartwarmer to make sure that we get to know you. So please open your Slido by scanning this QR code and tell us where you are from. And secondly, please, what excites you when you heard about this COP in citizen engagement and informed decision making? So just let us know those two things, and maybe you can throw in a color of your emotions as we begin this journey, and then we can check in later to see if the color of your emotion has changed at the end of this session.
Maybe you should keep the QR code. Yep.
Are you experiencing any challenges with your okay, perfect. Wow, we have people from a lot of countries. Thank you so much for participating in the heartwarmer. Let's see, what is exciting you? What makes you excited about this COP when you heard about it? Great. Collaborations, learning, meeting fellow EIDM community, I think also growing this network. This is exciting. I'm so excited that you are sort of aligned with what we want to do as well, to connect and collaborate, hear different experiences. This is so great. And the application of practical experiences or practice implementation. Wow. Thank you so much for participating. And I think the color question, we didn't put it on a QR code, so put it on the chat. Let me know. Are you feeling red? Are you feeling pink? Are you feeling white? Before we start, so that I know exactly how people are feeling right now. And I hope to change that color to a better one if it was not a nicer one in the beginning. So I'm really excited in terms of why you are here today as well. And I think just to tie that with the fact that we want to share with you, what this initiative is about in terms of what are the objectives, so that you can see some of them is aligned to what has just popped out in the icebreaker, so that you can see that we're really sort of we're moving to the same direction. Let me share with you the objectives of this initiative. All right. We deliberated on this and thought, why is this important? Why are 3 organizations that are supposed to be doing some other things in the world want to be part of citizen engagement? So one of them, we thought the field of EIDM had primarily focused on translating research into evidence, into policy, with less emphasis on public participation. So we really want to be part of, increasing public participation in EIDM. So that's something that we want to do. And also a community of practice on citizen engagement and informed decision-making in the health sector is being created to address this particular gap that I've just shared, in terms of to ensure that we increase public participation in this space. And the COP participants strengthen the capacity to promote citizen engagement in their own context, and they foster stronger and social participation in social policy processes. So this is important to us because of these 3 particular reasons. So I hope you share the same reasons why we felt we want to be able to increase public participation, close and address the gap that we have available, and also make sure that people are able to use this in their own context where they work. And then we thought through in terms of, what are the objectives then that we want to achieve with this community of practice. So basically, we want to create visibility of the work of citizen engagement in EIDM. And most importantly, also, we want to facilitate understanding and use of mini-public specifically, and citizen engagement generally. And also, we want to test and improve existing resources and guides to ensure that they are useful for the community practitioners. And also, we want to provide peer support, informal exchanges, sharing and learning from experiences, so to find a community that is interested in what you are interested in. And lastly, we want to stimulate debates and generate better understanding of practitioners' needs, and additionally, the resources and or the support. So this is why we really are interested in building this community of practice to achieve these particular objectives, and make sure that by the end of different processes that we are following, we're able to say, yes, we've worked so hard to try and achieve these objectives, and also why we are doing it, because we need to constantly go back to that to say, why are we doing this work? Because it's important to all of us.
Sorry,
so I hope that helps you.
Can I just interrupt you for a minute? We have had in the chat box that we don't use acronyms, that we just say them out loud as they are. So EIDM is evidence-informed decision-making for those who are not aware, and COP is community of practice. Apologies, and we'll try not to use acronyms moving forward. I know it's natural for a lot of us to use acronyms. Sorry about that, and thank you.
And C is citizen engagement, right?
It's citizen engagement, yes. All right. Thank you very much for that. I'll make sure that I do that. I think now we want to present the agenda of the meeting so that you know what we set to achieve in this meeting today. So the items were 3 items on the agenda. One, we want to do a capacity building activity where we'll have Prof. Sandy Oliver presenting to us. And then secondly, we want to develop the community of practice together, where we are going to take time to discuss the vision statement and formulate the working groups that will help us build this community of practice further. And then thirdly, we're going to close the meeting and also share with you the plans for the second virtual meeting that we will host for this community of practice. I think we have reached a very exciting time and moment for me to introduce to you Professor Sandy Oliver, who is a co-director at Evidence for Policy and Practice Information Center at the University College London Social Research Institute. It is such a great honor and privilege to have Prof. Sandy joining us today. I think a few days ago, she was celebrating 17 years of doing this work in this particular center that she works in. So you can see the caliber of person that is going to talk to us today to ensure that we understand and apply techniques for integrating different types of knowledge, and also we sort of understand, have a better understanding of trends merging different forms of knowledge. So I'm very excited to really introduce Prof. Sandy to all of us. Prof. Sandy, over to you.
Sandy, you would need to unmute yourself, please.
Yeah, you're muted.
Sorry, complete failure. I'm also failing on accessing Zoom on my laptop, so I'm coping on my phone. So I will be asking somebody to move slides when I get that far. Okay, thank you.
Sure. Okay, you're okay. Good.
Thank you. Thank you. So Sadhiri, thank you so much for inviting me. I'm really excited to be here at your first community of practice meeting. Everybody here is such enthusiasts for citizen involvement in evidence-informed policy making. I'm sure any of you could talk about the state of the art and trending debates, but I can just bring you the ideas that I've come across recently that I'm finding really stimulating and thought-provoking. So next slide, please. So I'm sure that you're all familiar with the range of knowledge that we're trying to tap into when we open up decision-making to a broader range of people, that we're not interested in only the research knowledge, but also the tacit knowledge that people bring from their personal lives and their working lives, their practical skills and know-how, and also what they know about the usual ways of doing things that have already been agreed. And they're all absolutely vital alongside the research knowledge. Finding examples of where broadening the input in this way actually makes a difference to the evidence and then to the wider world, that can be quite difficult to come by. But on the next slide, there is a very small study that we should find really encouraging. So this is about a series of syntheses. They were systematic reviews of all sorts of shapes, sizes and designs that were funded by the Foreign, Commonwealth and Development Office in London. And of these 31 reviews, 11 of them had real impact in the real world. We could find examples. There were 8 examples where they'd informed a decision, and there were 3 examples where they'd informed a group's thinking first. And for all 11 of these, there was a wider group of stakeholders involved in debating the scope of the work, either an individual piece of work or a larger piece of work with some consensus development beforehand. All of them integrated social values into the design of the review, either as designing components of the intervention or a theory of change or outcomes of interest. And all of them showed strong evidence that there was clear certainty and transferability of the findings. The other 20, we could find no real world impact, and all of them lacked one of these, either the stakeholder involvement or the social values or the strength of evidence. So we take this as encouraging the idea that involving more people, integrating social values, that's just as important as the technicalities in the strength of evidence. Next slide, please. So the challenge then is to think, how are we going to gather this wider set of knowledge that we need? And there are lots of different processes. I'm sure that you have your favorites, and you know, it can be participatory action research, it could be some skilled facilitation of discussion around a table, you can have some human-centered design where you have groups involved or individuals involved, or you can go out and find out who's doing exceptionally well in difficult circumstances and what can we learn from them. And all these processes and many others, they can be used for developing policies, implementing policies, or in evaluation and monitoring. And I guess that you've got experience in one or more of these. But it isn't just who's there, who's invited. It's also what happens once they've arrived. So next slide, please. It's also about who's speaking, who feels safe enough to speak, who's listening, bothering to listen, who's actually having some influence. And one way to track the ideas is to just check whose ideas are being expressed. Are they being understood by the other people involved? Are they integrated into the ongoing work? And are they retained in that work, or are they lost? And finally, are those ideas acknowledged? Is it clear where they came from originally? For all this to happen, everybody involved has to be constructive about how they interact. So inclusive, evidence-informed policymaking is actually everybody's responsibility, not just those issuing the invitation, but those accepting the invitation too. Next slide, please. There's a massive literature about how small groups can make decisions together. And there's a massive knowledge that isn't necessarily written down. So we know how to do this work well, partly from learning on the job, direct experience of collaboration, developing our skills, but also there's an impressive social science literature. We're familiar in health about evidence-informed decision-making for guideline development, but we can also look outside to other settings, so governance committees in business or in research ethics. And there's also studies that are experimental designs in social psychology to see how people respond to different challenges in group decision making, and development studies and studies of how people view things from two different perspectives at once. And another literature, which I'm sure has been there for quite some time, but isn't necessarily known to the people looking at social science, is the neuroscience, the work that's done looking at what happens in our brains during communication. Next slide, please. So if we've got a group of people who want to make some decisions, and if they don't all agree at the beginning, then to come to some agreement at the end, it requires at least one person to change their minds. They might change their mind because they're persuaded by rational argument, or they might change their mind because there's some emotional or moral pressure. We know quite a lot from studies of advertising about persuasion. There are also people who are particularly good at listening to other people, that they have an open mindset, they welcome new ideas, and they're very happy sitting at the boundaries between different groups of people, and can think creatively around that. But what we're looking for is not individuals and individual changes, it's a collective intelligence, so that what we're interested in is what we do together, not what we do separately. And I'll come on a bit later to how we're hardwired for making good decisions together. And one of the steps towards that is being generous towards what other people know and having some humility about what we think we know. Next slide, please. So this person here, I heard her earlier in the year. She's not a researcher, but she's exceptionally good at getting academics to work together. That is a real achievement. So she was talking about what she knows from her own practice. And she was talking about helpful mindsets, mindsets for growth, being curious, problem solving, taking up unexpected opportunities. She also talked about unhelpful mindsets, being fixed in our thinking, being skeptical of new ideas or skeptical of experts, being process-driven in our thinking, and how that doesn't help us work together with a mixed group of people. Next slide, please. So what she was really interested in was not only our mindsets, but the behavior that follows from those mindsets. So how good are we at sharing information, seeking feedback, looking for support when we're struggling, appreciating difference? All these things are things that help us work in mixed groups of people. Though, of course, being a researcher, sometimes I think, well, actually, I'd quite like some data on that, even if it looks like it makes sense. Next slide, please. But when I got to her next list, I reacted so strongly to it. I thought, I don't need the data. I can feel that this is right in my gut, that the negative mindsets and behaviors that happen when you're triggered by being outside of my comfort zone, being criticized, making mistakes, especially embarrassing mistakes. When we're triggered like this, we don't collaborate well. And I didn't need the data to agree with her, because I've been there, and I expect you've been there too sometimes. It's all those things that we don't admit to other people. Next slide, please. So going back, so that was the practice knowledge. Now, a little more detail about what we know about making decisions together from the research. So we have the input from the different skills and knowledge that everybody brings. And then once we're together, we have the information processing. What do we do with it? How do we discuss it? Well, if we've got plenty of time, then we deal with it well. If we have good facilitation, we deal with it well. The group matures and we have good problem solving. If time's limited, then what tends to happen is that there's less problem solving, more negotiation, and the more senior people, the louder voices, get their way. We're in a rush and it doesn't work so well. What we're looking for is shared learning, better decisions, so that when the decision's made, everybody's committed to the decision and it looks sensible from the outside. That takes time. Next slide, please. So I'm going to tell you about a piece of work that we did where what it was like when this happened in practice. We had a group of people setting priorities for research about preterm birth, when babies are born too soon, too small, too sick. We had the input, the skills and knowledge. It was a mixed set of input. Some of it was rational argument and some of it was emotional argument. There are a lot of emotions around preterm birth, unsurprisingly. And at the beginning, when we had plenty of time, we had several meetings over many months, and the group grew together, and we had our problem solving, and people were listening to each other and very constructive. Then there was a last meeting when the invitations were expanded to include some newcomers, and it upset everything. We found that the newcomers hadn't had that time to gel, to commit to listening to each other. The hierarchies came out more, particularly because this was to be a last meeting, we were short of time, and suddenly it was the senior clinicians who were having more influence than the parents of preterm babies. So we ended up with a research agenda where there was more attention paid to the high-tech interventions and less to the social agendas that were important to the parents. The interests of women who are more at risk of preterm birth, ironically, those who are lower socioeconomic status, their priorities slip down the agenda. So this was learning from our mistakes. We will never again rush into something with a new set of people. And it was really interesting to see that everybody's agendas aligned with the decisions that they were responsible for. So the clinicians wanted the evidence for what they had to do, and the service users needed evidence for what they were interested in caring for the newborn babies. But lastly, there were some people there who were both clinicians and had personal experience of a preterm baby, and their priorities aligned more with the service users than they did with the clinicians. So it suggests that the difference in priorities was nothing to do with how much you knew technically, it was how much you knew directly, and it was to do with your values, not with your knowledge. Next slide, please. So if we're going to work well together, we need a bit of intellectual humility. And I've read but not tried, and I'm not quite sure where I'd fit it in, but you might like to try this, is when you're getting people together, to encourage them to think about what their most important values are, and how those values may have changed. Were their values the same when they were younger? Do they expect them to be the same when they're older? And apparently, this is a helpful way to increase open-mindedness and intellectual humility. I haven't been brave enough to try it yet, but maybe somebody here will. Next slide, please. So if we have collaborative individuals, then hopefully we'll have collaborative groups and greater collective intelligence. And the collective intelligence of the whole group depends so much more on the group collaboration processes than on the intelligence of individual members. And apparently, if you've got a group, the larger proportion of women, the more attention they pay to each other and the greater collective intelligence. Whereas if you've got a group of men, they tend to work with a more competitive ethos. So if you put one or two women in a large group of men, they struggle because they're not used to that competitive ethos. But conversely, men will also struggle if you put one or two of them within a group of women. So we have natural ways of working differently, and we need to take those into account to think, how can we make the most of everybody who's taking part? Next slide, please. So all this is working towards the aim of collaborative learning, problem solving, understanding better, creating new knowledge. And it relies on all those small scale interactions and collaborations, the mutual respect for other people's abilities and contributions, and consensus building and cooperation. So that's not just the people running the show, but it's for everybody involved. Next slide, please. And this is where the neuroscience comes in. Fortunately, we've evolved over millennia to work together well. That's why we've survived. And neuroscientists have shown that our brains will synchronize their signals in particular social situations. Particularly if we're sharing knowledge, they'll synchronize better in a discussion than in a lecture or reading or watching videos, and they'll synchronize better with this prior mutual eye contact. They work better with turn taking too, particularly when they align speech patterns together rather than reacting to the computer. And there's more alignment with problem solving than simple cooperative jobs, and more alignment with face-to-face communication than back-to-back or a monologue. Next slide, please. So the conclusion is that inclusive approaches can integrate culture and social values into evidence and make a difference in the wider world. But everybody is responsible for making it happen. We need safe spaces, we need to manage hierarchies, but know that it's promising because we're hardwired for collaboration. But when it doesn't work, we can learn from failure too. Thank you.
Thank you very much, Sandy, for the presentation. It was really insightful and helpful on the journey that we are taking. So I'll take this moment and just take a few questions on the floor. Maybe we'll spend 10 minutes. What we can do, we can take 3 questions and then we respond to those questions and then go back and see how much time we have. But if we don't finish all the questions, please put them on the chat, then we will see how best to respond back to the people that ask those questions. Can I have 3 questions, 3 burning questions after this great presentation? I can see
I
any.
can't. Hi. Sorry,
Hi.
I can't raise my hands. Can I just jump in?
Yes, please.
Yeah, hi. So my name is Satya, and I do work with Tanya. We are working together. But all this stuff took me back to some really great stuff. And I mentioned it in the chat. It reminded me of the work of Robert Chambers and also Paulo Freire. But the question I would have for you, Sandy, is this. How can we do all this without making it tokenism? Because it requires a lot of effort from good people like all of you who are here to make this engagement happen. And lots of times it could be just tokenism. How to avoid that? I'm saying this because I truly believe in it, but I'm slowly losing hope sometimes because enough of this is not happening. But thanks for a wonderful presentation. Over.
Thank you very much for your question. Second question.
If I can jump in. Sorry,
Yeah.
Jack.
Okay, no, I saw Jack. Okay.
I just wanted to say
please.
thank you.
Ask the question.
Absolutely brilliant presentation. And yes, sorry, I'll get my connection for it. I'll leave it there.
Thank you, Jack. Sandy, if you remember, I was curious to hear a few examples of the different evidence needs from the different groups from your example about preterm practices, right? So you mentioned that the service users had different needs compared to the clinicians. It would be interesting to hear a bit what were those differences.
Okay, I haven't looked at the list recently, so this is dredging my mind back. It was things about how to look after a preterm baby, the feeding, the caring for them on a daily basis, and also coping with the older children. The social and emotional family focus was of more interest to parents than it was to clinicians. Not surprisingly, the clinicians don't have that responsibility once the baby's gone home. So, shall I go back to Satya's question now?
Yes, please. You can do the 2 questions, then I'll go to another round.
Okay, so thank you very much for that question. And I think there's a huge problem with tokenism. I think it really depends on what your motivation is. If this work is something that you truly believe is important, if your motivation is intrinsic, then there isn't a problem with tokenism. We saw a huge change in the UK when involvement went from the pioneering enthusiasts to being integrated throughout the NHS. And then suddenly there were people with new job titles who didn't have much experience, because obviously if you've got to grow quickly, then there are lots of newcomers. And so I think that we have to deal with people differently depending on whether their motivation is intrinsic or extrinsic. But basically, I think people need to be convinced by the difference that it makes. So if they can see the difference in how a policy is designed, the actual difference that it makes, the fact that it may get over some hurdles that, with the involvement rather than without. So we need those successes described clearly for people to understand it's worth the effort. And in fact, if we don't describe them, well, I mean, nobody would know whether it was worth the effort.
Thanks.
Does that answer your question at all?
Yeah. So, if I may, I have to react to this. So one thing is NHS is NHS, okay, and we know NHS is great, all right. So no, in principle, but I just want to give an example of this kind of decision making and engagement which really worked.
Yeah.
I just happened to be, you can call it a privilege if you want, but when the Ebola outbreak happened in Liberia, so I landed there, right? I ended up being with UNICEF, though I worked closely with all the people there. If anyone thinks that Ebola went away in Liberia because of the UN agencies for which I was working, they got it wrong. It was that massive community engagement, and the way they worked out in the end, it took a long time, it took 6 months, but when they worked it out, how they need to work to stop Ebola, that's when things happened.
Yeah.
Okay. So the UN agencies, the WHOs and the UNICEFs and the Red Crosses of the world, which I was a part of, we did all our bit. But in the end, if Ebola was stopped, it was because of all the community-based responses and the decisions that they took.
Yeah.
And I really hope someday someone writes this up in the right way, because all the writings that I've read, they don't give much emphasis on that. So I think I'll stop there. I think this excited me quite a bit. Thank you.
Thank you so much. I think in the interest of time, I don't know if Prof. Sandy, you want to just respond to that quickly, and then we can move on to the next session. The people that have questions, please put them on the chat, and then we'll address them a bit later.
Yeah, okay. So thank you, Satya. I mean, I'd love to discuss it with you another time. I've looked at the literature on resilience of health systems, and that literature puts a lot of weight on the communities responding immediately. So yeah, I mean, I think people need to know it's going to make a difference. Okay, thank you. Thank you very much.
Thank you very much, Sandy, once more. Thank you so much once more for joining us for this session and your contribution to the work that we are doing. Let me go to the next session. Please continue popping your questions in the chat and any comments or inputs after this great discussion. I think I need to ask to go to the next session, where we want to sort of discuss the vision and form initial working groups. So we will divide you into smaller groups and ask you to answer the following questions using the Google slides. So there'll be our team members that are in different groups to help you work this out. So we have 25 minutes to do this work. So the question that we need answers is, what would an ideal community of practice and citizen engagement in evidence-informed decision-making look like for us? And secondly, what specific needs or goals should this community serve? And then thirdly, what values do we want our community to be rooted in? And then lastly, what other aspects would you like to consider in shaping the community of practice? So the team will help me divide people into groups, and then we'll spend 25 minutes responding to these questions. All right, great. Thank you very much, everyone, for participating in the group discussions. So because of time, we will not do any report back, but we'll compile the inputs that we received and share with everyone. But I think there's one thing that is important we want to do is to set up the working groups for the development of community of practice charter, the work plan, decide on engagement platform, and monitoring and evaluation. So we'll use the QR code to sign up to the working groups.
Just to say, the link is also in the chat.
Okay, great. We have until 25 past your time to sign up to the working groups.
Cecilia, maybe one aspect we could raise is that it's not mandatory to be part of a working group, right? We encourage it. It would be great to count on everyone to support developing the different work streams. But if someone is only available to participate in the general meetings, that's also fine. And Maureen is asking what's M&E? That's monitor and evaluation. So keeping track of what the COP is doing and assessing the results and hopefully the impact of the COP.
Could you share a little bit of the working demand related to those working groups? So then we can also think a little bit about it.
In terms of the workings for the working groups, would like the members of the working group to put aside an hour a month for the working groups. And if you want to also join the monthly virtual meetings, another hour. So I think that's what we had. So we thought we'll just share it in when we do the next steps. Just 2 hours a month to share your time with us.
Thank you.
And we also expect the working groups to be very autonomous, right? So the team that gathers around each working group will have a lot of autonomy on establishing the work plan and how do you deal with the different tasks that they set up for themselves.
My question is more, and thank you all. My question is more concerned around scheduling, being on the West Coast. Of the United States, I'm concerned about 5 a.m. meetings. So how we can coordinate our schedules in ways that I know it's tricky in terms of the global membership of this group, but if we can, agree on a time that's perhaps feasible for all of us, I'd really appreciate that. Thank you.
Great, thank you for that input. So I think basically the first meeting of the working group, then we'll sort of discuss all of that and see what works best for different groups, because that will help us as well to know who is in the group and how do we agree in terms of the times and dates and all of that.
Yeah, one thing that we could do, Cecilia, is to have different working groups working at different hours so that maybe someone is able to join one of the working groups, at least if they're not able to join the other one, right? So I think it's impossible to have 1 hour that works for everyone in every part of the world. We can definitely accommodate so that the time is good for most people if there is a cluster of people around one time zone. But if it's too scattered, maybe some people just won't be able to join, and then maybe we can have them join a different working.
Thanks, Davi.
And someone asked when they're meant to start. I believe we'll be trying to set up the first meetings for next week. Is that right?
Yes. Great. I think our 5 minutes to sign up is gone. Maybe I think because this discussion already started, maybe other people were still busy signing up. So we just put together some next steps around the working groups so that as you decide, you know how much time is needed for you and some of the aspects. So we're expecting like an hour a month for the working group and then the hour for the virtual meeting like this one. So we're hoping to have the working group meetings in between this meeting and the next meeting, so that at least for the next meeting, the sort of updates from each working group. And then the first meeting of each working group will be scheduled by the organizing committee, as I've said, in between this meeting and the next one, so to make sure that we support you in the initial meeting. And then the first meeting will serve as part of to address organizational aspects such as assigning group roles, setting the day and time and of the future meetings. And then finally, each working group will provide an update and progress at each COP meeting, which is those monthly meetings that we are setting that are similar in structure, like the one that we are doing today. So I hope this information helps and makes you decide on how you want to participate in the working groups.
We have a hand up, Satya.
Yeah, just a quick question.
Savi?
I can easily think of some people who don't know about this, but who would love to be part of such groups and would also contribute a lot. So how do we pull them in? I mean, I know a couple of people who would be very keen if they got to know about this. I just happened to get to know about this accidentally, but there are others I could rope in. So how do we rope them in?
I think what we've done, we did a stakeholder analysis. We have a list of people that after this meeting that we'll send to them as well about the working groups, so that they can join the working groups. And also we'll also rely on our members to share with the other their own contacts as well, people that would be really great in contributing to the community of practice. But we've been working very hard to have a stakeholder analysis on people working in the citizen engagement space and EIDM. So we'll share this out and wide just to make sure that we get people to join the working groups.
Okay, thanks.
Great.
Yeah, I think everyone is invited and encouraged to invite people to join, right, CCO, as they map people that could be potentially interested.
Yes. Great. I think let's close the part of the working group there. The next slide. We have 2 minutes to the close of the meeting, so that we wrap up. Just to share, thank you so much really for participating in this session. And we're really excited in terms of the conversations that have happened here. Just to say that the recording of this session will be shared so that people can have access to the discussions that we've had here. We'll share widely as well about the working groups to make sure that people have an opportunity to join the working groups. And then lastly, just to show you the proposed agenda for the next meeting, we're proposing to have the meeting the 4th of December, same time as we're having today. So this session will sort of we'll have welcoming and introductions, and then we'll have presentations and question and answer sessions as well. So this one will look at a different topic from the one that we have today, and then continuously we'll always have a section to develop the community of practice. So there'll be group and plenary discussions to make sure that we advance the discussions that we've had. But I think what we'll do, we'll start with what we've compiled today from the groups, so that we move the discussions connect the discussions from the meeting today to go forward. And then lastly, we'll wrap up that meeting and also share the next steps. So that's basically what we are looking at for the next meeting. And we're looking forward to seeing all of you there and many more other people. Please spread the word, people that are interested in this topic to participate and help us advance it and grow this network. So I think that's it for today, unless there's anything else from my team that we need to share before we adjourn the meeting. All good? All right. So I think if we're all good, so thank you very much again once more. I think it is a great milestone for us to have this first meeting. So we're really looking forward to next meetings as well for this community of practice. So thank you very much, everybody. Cheers.
Just last thing, let's take a picture.
Yes, take a picture. Group picture.
Wonderful.
Okay. All right. Everyone that is still there, you can please maybe put on your video so to take a nice group photo. Thanks for reminding me of that.
Oh, I'm going to put on video. Ay, ay, ay. Ay, ay, ay. Video. Oh, my God. video.
Who is taking the picture?
I can take it.
Yeah, I can take it too.
Okay.
Can't help making the
There-
comment. There's lots of ladies in this group. I'm very happy.
That's right. So please smile. And then, sorry, I'll have to take another one because I don't have everyone on the screen.
Two screens, I think. Two
Okay,
pages.
fantastic. Done.
Great. Thank you so
Great.
much, everyone.
Thank you.
Thank you. Bye-bye.
Thank you
Thank you,
all.
everyone.